Sleep apnea is a very common problem that a lot of people have, but they don't see it as sleep apnea, because when we think sleep apnea, we think our favorite uncle who's 65 years of age and he's way overweight and he snores and he has diabetes and heart problems. And then we think of the cure for sleep apnea, or the treatment, is a CPAP, where essentially you have to wear the scuba mask all night long. But what most people don't realize is that's not where sleep apnea starts. It actually started a lot sooner than that. See, all sleep apnea is you're choking at night. Right now, when we're talking to each other, your tongue is in between your jaw. It's sitting right in here. But at night, when you lay down, your jaw falls backwards, so your tongue actually falls into your throat. The problem is at night, when you're losing that breath, the brain doesn't know when you're gonna breathe again. You ever been at a restaurant and you choke on a piece of food? And at first you're trying to be quiet, you're a little embarrassed, then after a while your body kind of starts tightening up. Now you really can't control it, and you kind of panic, you go into shock, and you all tighten up this way. Well, that's because the brain doesn't know when you're gonna breathe again. And about 10 seconds later you swallow the food or you spit it out, whichever, and then you go back to normal. But when you have sleep apnea and you choke on your tongue, and you may be doing this 50, 60, 70 times a night, imagine choking on a piece of food 50 times all in one day. You do it one time and you're panicked for an hour. Imagine all night. That's what sleep apnea is. So now what we can do from a dental standpoint is essentially make a device that's going to take your jaw and bring it forward about where you'd bite through a sandwich. That keeps your jaw from falling backwards, so your tongue doesn't fall into your throat, so you don't choke all night. So it's a much simpler, easier way than going with the CPAP. And you can bring this with you. You can bring it on trips. It's small, it's comfortable. And if you think about it, it's also going to treat a lot of the other problems that come with it. Most people with TMJ, it's really sleep apnea, but they're not overweight yet. They don't have diabetes. They may not snore. They don't know that they snore. They just know that their teeth hurt and their muscles ache and they're sore and they're tight all night. They don't realize that, yes, you have TMJ, but you have it because you have sleep apnea. So most of my cases for TMJ, we get them tested for sleep apnea. We make them a sleep apnea appliance, not a dental appliance for TMJ, and all their problems go away. Also, their health starts getting better, because if you keep spiking that cortisol all night long, and that's the hormone that's making you tighten up, it's also making you angry, it's making you depressed, it's screwing up your hormones, it's flooding your body with sugar, and that's why your insulin keeps trying to deal with that, and that's how you develop diabetes. It's making your heart speed up. That's why you start having heart problems, you start having all these different problems occurring in your body, but you don't realize it's sleep apnea, and you don't have anything done with it until the damage has been done. Most of the patients that we see that are between 20 and 30 years of age, they're all on antidepressants or anti-anxiety meds. They have no reason to be. They're on them because they're not sleeping all night. So all night long their body's stressed out, so they wake up just stressed to the max. So now anything throughout their day, life, kids, traffic, job, bills, all of that just puts them over the top. But instead of learning to sleep at night and getting that treated, instead they just take pills. And then 20 years later, they're still on them because the original problem was never addressed. So we can get a lot of people really healthy, but we address the sleep problem, which helps them feel right during the day.